our next discussant to spend about 5 minutes. Most of you know Amy Conrick. She is the Assistant Director for the Community Transportation Association of America.
Good afternoon. So I get 5 minutes. Everybody who knows me knows I speak very quickly, so I might be able to get a lot in. But actually, I really have a question, but just to, again, as a way of introduction, I am one of the assistant directors. There's a few of us at CTAA. But I'm also, along with Judy Shanley, who you heard from this morning, one of the co-directors, along with Rich Weaver as well from APTA, on the National Center for Mobility Management. To save time, I'd like to refer you to the last pages of your packet, which is where we talk a lot about what CTAA has done in terms of healthcare transportation. And also, I'd really like you to focus on what our healthcare grantees have done. They did an amazing job. There's a reference to our website there. You can actually listen to them pitch the solutions that they came up with. The system we used was design thinking, which is incredibly powerful, but stop me afterwards, and I will be happy to talk about it. So a question for our panelists. And I had to choose one. I had several, but I chose one to stay with my 5 minutes. How far, in your opinion, on a national basis, how far along are we in encouraging the healthcare system to recognize the importance of transportation in patient outcomes? For example, I was just recently learned that in the International Classification of Diseases, ICD-10, there actually is a billable code, several billable codes for transportation, which I didn't know about. But also, so I'll leave the question there. I'll just let you guys answer. How far are we? How much work do we have to do to really continue to embed transportation into healthcare?
Well, part of that is significant because while it is in the coding for this, you know, each state has their own Medicaid plans. They have to include those codes as billable codes as part of their state plan amendments, and so every state is a little bit different. You know, Medicare, as you know, is a one payer, and if you're looking at Medicaid, it's still very chopped up and things are very different. I would like to say that I think there's clearly in the healthcare system a recognition that transportation is significant. The whole issue is, again, if you look at the codes and you look at, for example, in our state, transportation is part of the Medicaid beneficiaries' benefit. But I will tell you that one of the things that we have to do, our community health workers have to do, is teach them how to use that benefit. Because while it is in the brochures that they get when they sign up, they really don't understand how to use it for a lot of reasons. Health literacy, the nature of being in poverty and not thinking, you know, that far in advance, and it's all part of that learning process. So, you know, I think it is definitely something that is on the mind of healthcare. I think it's because part of this issue is it's so fragmented still as a system. I'd be curious, quite frankly, after some of these endeavors that we're all involved in, and I don't know where to get that information, is to find out what impact our efforts have had in terms of patients using that transportation benefit. Because I think if we could find that out and then start replicating it, we might be able to get more systemic utilization of that and perhaps more interested on a national level, but it's just so segmented.
Just real quick, I think that's one thing that excites me about this project we're doing with the National Association of Community Health Centers is we're quantifying the need for transportation for healthcare. We're able to show that 19% of our patients have transportation needs. And then, you know, the next step is, what are we going to do to address that? What efforts did we make to address that? And then following up with the patient, did they, you know, if we have a navigator that helps them sign up for a bus pass or whatever it might be, how did that impact their care? So we can, again, data is what we need.
I think the uptake on the health side has been far less robust than it could be. I find that the transportation sector folks get it. and have for quite some time. On the health side, less so. And so I think that it's incumbent upon folks who are doing things like my colleagues that are saving resources, that they continue to make that case as strongly as they can, particularly as the health system is transformed, because what will get the attention of the health system is when you can demonstrate savings that they can share in, and that's the direction the health system is going in.
I want to add one thing really quickly. I do think what we're learning is that it is a discussion that payers have to come to the table in. Medicare, Medicaid, insurers. I know in Missouri, we are moving to Medicaid managed care statewide. In the last 4 months, I've had 2 health plans in my office talking about how to partner up with this moving forward, because it's a mandate under Medicaid managed care. So they're coming to the table now, but I believe the payer piece is significant. Flora has been a godsend moving into United Healthcare and carrying that flag. We've been doing a lot of work with her. I think that's the piece that it's going to take to accelerate the healthcare side of things, because the incentive has to be there, and the payers, I feel like, have to drive part of that conversation.
And you're right, that value-based approach, and we're gonna be doing that for the next 3 years with a target group. So